Hi guys, I'm Dr. Moran with Elite Sports and Spine Chiropractic. Let's talk a little bit about neck pain. Neck pain is probably one of the most common things that people come into the office for, or at least for chiropractic care. There's a lot of things that can cause neck pain, whether it's muscle related, a whiplash injury, so that would be like a sprain strain type of an injury. Common one is a disc injury, so we have radiating symptoms, numbness, tingling, weakness down into the arms, into the fingertips. There are things that can present as a disc, but actually aren't a disc, so there can be some tightness or compression within certain muscles causing that same type of symptoms. So let's talk a little bit about that, and then we'll get into a little bit of some treatment. Alright, so with neck pain, oftentimes there's radiating symptoms. So those radiating symptoms can go up into the head, they can go into the back, or the shoulder, down into the arm, or even the hand and the fingers. So what kind of things cause those radiating symptoms? Oftentimes if people have radiating symptoms up into the head or the neck area, it is usually musculoskeletal related. So that means a muscle tension that's causing radiating symptoms up into the head, or a headache, or skeletal, meaning there's a joint problem within the joints here within the neck. There's a lot of different joints, I won't get into specifics, but that can also refer pain up into the head or neck region. Some of the radiating symptoms down to the arm can often be radicular symptoms, meaning they're coming from the nerve roots themselves, right here, and then those go down into the arms, fingers, elbows, wrists, or it could be caused by the disc. So if there's an irritation of the disc, that can irritate the nerve root and then cause those radiating symptoms down into the arm, wrist, or hand. Oftentimes, if there is a disc problem, sometimes people will have pain within the wrist, like it's a dull, achy, toothache type of pain within the wrist or the elbow, and it's correlating a little bit with some of the neck pain that they have. So stick around, we're going to go through a couple treatment options, and you can see what we do. Alright, now let's talk about some treatment options for people that come in the office with neck pain. Oftentimes people that come in with neck pain to a chiropractor's office thinking they're going to get adjusted. That's not necessarily the case when you come in here to Elite. There's a lot of other options with treatment. We're going to demonstrate one of those being soft tissue work to the area. But some people are a little bit nervous about being adjusted, so we'll determine that through the exam if that's something that's even necessary, but it might not be. So one of those things is soft tissue work. So for our patient today, I'm just going to be pressing into the area that's really tight, and the patient's going to be moving the neck in a certain direction that we already told them to do. And it's just a simple pressure over that area, and for the patient, usually this feels pretty good. And then afterwards, after they're done, they usually feel a lot less tight within that area, and oftentimes if they're having headaches or tension or pain or whatever it may be, that relieves it itself. So other options, we have taping methods with kinesio tape. You've probably seen that stretchy tape that Olympic athletes will wear. We do traction on the cervical neck, so that lifts up and distracts the joints and stretches out the muscles within the area. There's laser treatment, which we've talked about in other videos, as well as we implement therapeutic exercises. So strengthening the areas, stretching the areas to help promote longer lasting effects.